Hey, everybody, welcome back to another episode of the Horse Geeks podcast, where we look at horses and riding from the inside out. I'm Kirsten Nelson, professional horse trainer, and with me today again is Dr. Anne-Marie Hancock from True North Equine in Marshall, Virginia. I got that right this time.
You got it. Yeah,
And
that's
today we're
right.
going to talk about osteopathy because that's one of your specialties as a vet. So you have your
Mm-hmm.
DVM as a equine vet, and osteopathy was something you did on top of your veterinary studies, correct?
Right. It was a 3-year program through an osteopathic school that teaches equine osteopathy, and that was based out of Texas at the time. Mhm. So it
Great.
was like we would go once, every couple months, and we would go for 4 days and kind of learn the next section, and then go home and practice it, and then go back and learn the next section. So that way, I think by the time you get, a couple years in, you have had some practice under your belt. You kind of know what questions to ask.
Excellent. And what made you gravitate to osteopathy? Like, what was your interest in it, or what did you see? What kind of benefits did you see that made you want to take that on?
Well, so I'm a California girl originally. I grew up near Berkeley in San Francisco. So I guess I have a little bit of hippie dippy in me because of that. And so I was always really interested in holistic medicine and acupuncture and all those sorts of things. I think probably just because early exposure to it. And when I was in veterinary school, I went to Colorado State. In the year that I was a junior in veterinary school, they actually taught a veterinary osteopathic class to graduate veterinarians. So there were two exceptional equine osteopaths. One was a human osteopath that worked on horses, and one was an equine surgeon they were both from Europe, who had learned osteopathic medicine. And they taught that class that year. And so when I was a senior, my lameness professor that I had when I was doing clinics had just finished this course. And so about half of what he did on our lameness elective was osteopathic. So he was working on manipulating horses that had lamenesses and looking for change. And so I think I got really lucky because they only taught that class for 1 year.
Oh,
Both
wow.
of those people that were so amazing died suddenly the next year. And so the class disappeared. It's never been taught again. And so I think if I hadn't been in school, like right when I was, I probably wouldn't have been exposed. So that was sort of my initial exposure to it. And the person that I had as a latest elective professor was Dr. Gail Trotter. He's down in Texas. And so I thank him for exposing me to that. And then I've just happened to meet a few osteopaths after that. So I met some of the people that had learned from those osteopaths that had died, and was able to kind of learn a little bit from them, and then found out about this school. And I just really wanted to do it. I think one of the things that's super cool about using equine osteopathy to do things versus equine chiropractic is that it's much easier on the osteopath, on the therapist.
Ah,
So one of the key components to using osteopathic manipulation versus chiropractic is that you're trying to get the patient to help you with the manipulations, right? So when you do a manipulation with chiropractic, oftentimes they use their wrists, and they're going to do a quick thrust, and it's the person or the horse is sort of in a static position, and then the therapist is who does the manipulation with a quick, direct, high acceleration impulse. And most of what you do as osteopaths is more about getting the body to move into the joint space and motion that you want, by getting the person or the animal to move and side bend and rotate, so that you're just assisting it, but more from like the edges of the joint, like a long lever technique. So the amount of force that goes through your body is much, much less.
yeah.
So I think that initially that was one of the things that really attracted me to osteopathic work versus chiropractic is, just trying to think about how can I do this for 40 years? Because you see a lot of chiropractors that end up with wrist arthritis and elbow problems and finger problems, all these things from doing all those adjustments. And that's not necessarily the case when you do osteopathic work. So
No,
that
and
was
I
kind of
I think
the
with the
initial draw.
like looking for the individual to sort of work with you in the adjustment too sounds like it involves more soft tissue changes than just a bone adjustment.
Exactly. And I think that's what has kept me in the osteopathic realm. Like, why do I really like it? Is that it's not just better for me, it's better for the patient because you're getting all of those levels free. So you're working at the level of the muscle and the level of the fascia and the level of the joint capsule, if there is one, and you're looking at the nervous system connections and you're looking at the organs and what's holding the organs around that area and what are the what things are connected that are not even close by that might be influencing the motion of what you're looking at, as well as the bone.
Right.
And so I think because it's that whole picture, and it's really fun to work on in that realm when you can have all of this effect with so many different ways to do it, right? Which is, I think, what makes it so much more fun in the long run. And
Yeah,
hopefully, the
I've
other
just
point
found it's been a
that
more
it lasts long.
effective, like it's more effective, I think, for people and for the horses than the results that I've gotten from chiropractic or massage. And it's more like, I like the way you put it, that you're asking the individual to really make the change and you're more of a guide rather than sort of
Mhm.
going in and doing something to the body. You're kind of working with a repositioning of sorts.
Yeah, absolutely. And I do think, that's why you get what I hope is usually long lasting change is that we're working with the patient and we're working on all of the levels that would be influencing whether that joint would go back into dysfunction or not. And so when you look at it that way, then hopefully you change the cycle. You allow the body to then change. Yeah. So I mean, that's really what you're trying to do is you don't want to have someone visit you all the time forever, right, with the same
Right.
problem. You really
Right.
want to be finding new problems, or fixing what they did in the pasture last week instead of, fixing the same shoulder problem for years and years. Like you want to move past that and, find, just little things to work on most of the time.
Yeah.
So it's pretty cool.
No, and that's how it's been super symbiotic in my work is uh, a lot of body workers will recommend me because there's something that the horse and rider are doing in work that's creating a repetitive strain or repetitive misuse. And then I love working with the body workers because I go, okay, this is going to be really difficult to actually work our way through and just helping the body remember where it should be and then supporting that with the work seems to be kind of a really nice combination in rehab to get everything back on track and kind of moving the way it should
Absolutely.
go.
I mean, I like if you have something that's really stuck, it's very hard to break through that just with training and motion. I mean, you can get a lot of it, but you're still going to have certain things that really do need to be moved and
Yes.
changed, with some sort of manipulation before they're really going to move the way you want them to.
Yeah. Because in work too, it's finding the path of least resistance to change. Like horses don't understand no pain, no gain. Like as soon as you hit a certain threshold of discomfort for that individual, they're not going to explore anything new anymore. They're going to protect. And I go, that just keeps repeating the habit of movement or the dysfunctional problem. And so bringing ease into the body. And I love that you're vet osteopath because I go, you have all those tools. Some people are strictly holistic and some people are strictly allopathic. And I go, I want what works. Like just give me something that works that
Great,
has
whatever it is.
the least amount of side effects possible, but give me something that works.
Absolutely. Yeah.
And
Yeah.
so
Well,
can
and
you give
so like,
us, oh, sorry, go ahead.
no, you go, you go.
Oh, I was just going to say, can you give us like your cocktail speech on what osteopathy is, or like what is it? How does it work? How is it different? Well, you talked about how it's different. Um, and you basically described what it does and that it theoretically should have longer term residual holding effects. Like it's not going to pop out as easily, like a subluxation that a chiropractor fixes. Is there anything else you want to talk about
Right.
with osteopathy in general to help people understand what it is, how it works?
Sure. I'll kind of give you my spiel. So I
Okay.
usually start by explaining the origins because I think that when you explain where it came from, then people understand it a little better. So osteopathy is actually older than chiropractic, and chiropractic came out of osteopathic medicine. So if we look at the history of osteopathic medicine, we talk about it starting in the 1840s to 1860s in the Kansas and Missouri territory. So it's an American, invention. I'm sure other people were doing it before that, but that's where the name was coined. And it was, in the same age when homeopathic medicine was developing and modern conventional medicine was developing. So there weren't doctors that went to medical school necessarily. They were taught by other doctors, right? And this is how they were learning, or they learned from books. And there was a lot of quackery out there. And when you got a pharmaceutical, oftentimes it was, some sort of tonic that someone sold in a wagon on the side of the road,
Right.
right? And so, people didn't necessarily believe in all of these medicines and tonics at the time. And so Andrew Taylor Still was a doctor, and he lost his family to, I think it was like a mercury embedded toxin, that was in a medicine or something like that. So he lost his wife and his children, and he wanted to find a better way to do things. And he started treating people for cholera using body manipulation. So he found that if he got the spine mobile, that they could then heal from cholera, heal themselves, versus having to take medication. So that's kind of where he started from. And he just started realizing, there were some principles that really worked. So he started the school in Missouri, and a lot of people came to it, and were learning from him. And that's where the chiropractic schools came from, is from students at the osteopathic school. And then there were other students that came over from Europe. And so then a lot of those Europeans that went back to England started adding in something called craniosacral therapy, which has to do with the motions, very small motions of the skull, and the symmetry or lack of symmetry of the flow of cerebral spinal fluid production and absorption. So you can actually feel that. And so that really came out of the UK. Most of the cranial sacral work has come from a lot of the people that went to Missouri and then went back to United Kingdom, and then it's sort of come to all these other places, but that's kind of where it started. And then the third part of osteopathic medicine has really come out of continental Europe more than anywhere else, and mostly France. And that's what we call visceral osteopathy. And that's really about understanding the connections of what we call the autonomic nervous system, which
Mhm,
is
mhm,
our parasympathetic and our sympathetic systems,
mhm.
like the ones we don't think about, and how those anatomically fit in with the spine, like where are they located? So how would they be impacted by spinal immobility? And then how does that affect organs, and how does that affect overall wellness, those sorts of things. So most of the parts of the organ mobility and the nervous system mobility came out of the continental European schools, which are probably, like, those ideas are maybe like 40 to 50 years old. So
Wow.
when we talk about osteopathy now, we talk about it as, that original structural manipulation, bony manipulation, more
Hmm.
traditional, like chiropractic. And then we add in the cranial sacral, and we add in the visceral. And it's the combination of those three approaches, and you do use all three in each therapy session, that really allow you to get that long lasting change, because you're really looking at the pattern in the body. And so then by using those three techniques, then we kind of have these like rules about, how do we treat? And one of them is that structure and function are interrelated. So if you have a structural problem, you have a functional problem, and vice versa, right? So then if you have a problem with, let's say, the left shoulder, then you probably also have a problem with stomach, or if you have gastric ulcers, you might have a problem with the left shoulder, so you can kind of combine these things and, look at them that way. And then the second thing is that anytime you have immobility in an area, you compromise the vasculature, so the blood flow and nervous system flow to the area. So then you get an area that's less vital. So we talk about that as a terrain, so an example would be like, why does one horse get a suspensory injury, and another horse doesn't? Well,
Mm,
is the horse that has the suspensory injury one that already has decreased mobility, in the knee or the carpus on that leg, right? So the blood flow isn't as good, nervous system isn't working as well, it can't heal as well, and that's the part of the problem, right? So
right.
that's the terrain concept. And then I think the other one that's important is the idea of the body can heal itself. Um, so I think that is different between chiropractors and osteopaths. Like I see a lot of people that see chiropractors frequently, in the human world, maybe once a week or
Mm-hmm.
once every 2 weeks. And in the equine world, maybe every 2 to 3 weeks or at least once a month. And what I find is that what I really want to do is get the body moving and then leave it alone and let it fix itself. Because once you get all of those things connecting and talking to each other, it really will start to heal on its own. And that's where, like, what you do is perfect, because we get the body mobile and then we move the body, and the body stays mobile and learns new things. And the nervous system realizes that now it's more level in how it's standing, and now it can bend its neck this way, or whatever it is that it
Yes.
wasn't able to do. Giving the body then time to kind of reset, I think, is really important before going back in and doing anything else.
Yeah.
I used to find that if I went back in 2 or 3 weeks, because people would want me to, that I'd almost make it worse rather than
Oh, by
better.
doing,
Like I
and you
would
know what?
step
I'm so glad you said that because I've learned over the years to get more and more and more selective over any body worker because I think in normal human ambition, and I've seen every single body worker at least go through this phase in their development, that the more they know, the more they want to do. And what I learned
Mhm.
from some of my, one of my mentors who's an osteopath is like the less you do, the better. Because if you do too
Right.
much, it's like that's how the body was finding stability. And so you throw the body into chaos if you take away too many tight spots or too many dysfunctions all at once. It's like they're just massively unstable and you get new problems. And so really you said two things. I forgot to write down the other one, but it's, oh, the body heals itself. I go, that to me is a defining philosophy for people I want to work with who do holistic medicine. Because even in training,
Mhm.
there's this concept that we put information in the horse. And I go, no, we're drawing out what should be. And that's why the body recognizes it. I go, we're drawing out a skeletal coordination that's working with the inherent design and its function and form, just like you said. Every part of the body, the design of it or the structure of it tells us the function. So we know where resistance should be more or less, where mobility should be more or less, where stability should be living. And and so that sort of body heals itself, the form function or structure function principle. And then what you said about overdoing. I go, that can happen in training. I see it all the time, and it can happen in body work, and it can even happen with, watching my aged dad. I go, medications. Like,
Mhm.
you really have to kind of watch how much are we trying to fix this body rather than letting it heal. letting it find its way back
Right.
to homeostasis. So I just wanted to
Yeah, I
check
think
because I
that's
got all
very
excited.
true. Yeah. Well, but I think you definitely see that in the equine world that everybody always wants to just like, we're just gonna make that go away and we'll move on to the next thing, right? If we just hide that problem, then we can keep going. And so oftentimes by the time they see you or me, there's a stack of 20 problems that they've hidden or, put on mute or injected this or done that, so that they could just keep going. And so when you start taking those layers off and trying to get them back, you're trying to get to that root cause, right? And you're trying to get them back to where they can create that self-balance and, have and like you said, the wisdom of the body to tell them how to move correctly, right? Like that innate wisdom that's already there.
Hmm.
And that takes a lot of time, which is also hard because everybody wants to get to the next show,
Right.
or the next thing. And it's hard to start down this process and be like, oh, I know you probably don't realize this, but when you make this step to more of a holistic or natural way of moving, and you start understanding why that's more important for health, it's almost like you're taking that first step off the ledge, and you really do have to go. You've got to take the free fall, and take the time to kind of absorb it all. There's so much, it's so different. It's a completely different way of looking at things.
It is. And it's the
That it makes it
paradigm
really
shift.
hard.
Yeah, the paradigm shift is
Yeah, it
hard.
truly
Yeah. And
is.
I go,
Yeah.
usually when I meet people, the horse has failed several therapies, several trainers, they're not getting the problem resolved, and they're not willing to just pass the horse on. And I go, people with problems
Mhm.
suddenly are more open to different ways of doing things or looking at it through a different lens. And so you're right. It's not for everybody because it depends on the person's agenda and what's working for them. But I go, once we have dangerous behavior and physical lameness, I go, now that's my wheelhouse. Like we can
Let's take care of that.
we can take care of that.
Yeah, I
Yeah.
absolutely. I think that it it makes me sad in some ways that the horses that we get are the ones that are so far down that path, right? And I'm happy that I can help them. But I wish that, they could, I wish that we could do more of this for horses that weren't that far down the road. I'd much
Yeah.
rather have clients that are thinking about this with their yearling or their 2-year-old, or how am I going to start training this horse and how am I going to develop them from the beginning so that
Right.
they don't have these problems, rather than starting with the 15-year-old horse that already has been ridden in a way that hasn't developed the back and has heart arthritis and has back problems and has neck problems and all of the things that usually come with that.
Yeah.
I mean, it's really fun to see those horses at 15 start to, like, you know, get younger,
Yeah,
where all of a sudden at 20 they look better than they did at 15. I mean, it's really fun to see that,
it is.
when people are willing to go that route. But it is sort of disappointing that it isn't something that we're doing with our younger horses more. I'd like to see that more. I think that would be
No, and
good.
I hope for it to change, but when somebody calls me to start their young horse, I kind of like get a pit in my stomach because I go the way I now insist on starting young horses and, no younger than 3. And the first 6 months is going to be walk, maybe a little trot, maybe some canter on the ground. But I go, we're going to work on coordination. And it's so slow and it's so hard to see it happen when you're the one on the ground that it
Mhm.
looks like I'm not doing much. But I go, here you
Right.
have this young body that could go any direction, and they're so much easier. People think it takes more time and it appears slow because you're not doing walk, trot, canter in 30, 60, 90 days under saddle. But I go, once you plant the seed of correct coordination and they know how to carry a rider comfortably, they also retain that. And I go, so over the long term,
Absolutely.
you have a healthier horse and you have a horse that moves better. But I still hear the same old crap, pardon that, but it's just crap to go, oh, your horse just doesn't have the conformation to go to the next performance level, right? Your conformation's no good.
Yeah.
And I go, or that horse's personality is no good. And I go, no, the horse is terrified. That's why they have a bad personality and or stuck in chronic stress. And I go,
Hmm.
you've seen and I've seen both through osteopathic work and correct training that what we call conformational points, like what they show for in conformation classes, I go, those are
Hmm.
just body part relationships, and that changes. That is not,
Absolutely.
it is not as fixed as people think.
Yep. No, we did that. I think it was maybe the first or second year I had moved up to Virginia and went to an Arabian show, and we had a group of people there that were doing demonstrations, and one of them was a horse judge. And so he pulled out, like, I think it was two 3-year-old geldings, and he was talking about how this one has cow hocked and this one's, base narrow, and this one, has these conformation problems, and this other one looks much better. And we kind of looked at them together, and I was like, but I can make that other one look just like this one if you just give me an hour. And
Yeah,
we did that. I did my osteopathic treatment, and then they both were standing base wide, and they both had the same conformation. And I think if we could do that more often, like, hey, this isn't a problem of this horse is doomed to look like this.
right.
This is where the restrictions in their body are. Yeah.
Yeah, or
So, I
even
mean, it's
people,
very cool to see that.
it's very cool to see it when you can show a turnaround quickly with a few osteopathic adjustments or changes of posture. I go, it looks like a completely different horse like that. So you can't tell me it's that these conformational relationships of body parts are static. I go, okay, you can't change the size and the density of the bones. I go, that to me is conformation. But I go,
Right.
otherwise, that coordination of the skeleton is very changeable. It's not fixed. And that's awesome
Absolutely.
because,
So,
like, I see these stupid workarounds, like, particularly when you mention Arabs, because the training has gotten worse and the breeding has gotten worse on Arabs since they first came in the 80s. And what they're doing now in these breed shows is they're parking these Arabs out to not make so the back doesn't look so sway. I go, it's crazy. Like
mhm.
they're just stretching out the hindquarters until the back looks flat. And so they're just disengaging these horses because if they stood there
Right.
square, they would look like they have a short neck, drop back, high croup, because that's what they all look like. And so what they're doing is teaching these horses to elevate the neck and just park out with the hind legs. And that gives the appearance of a nice flat back. And I'm like,
Right.
really? Really, you guys?
I know. Yeah, that's true. Well, yeah, there's just so much that, I mean, unfortunately, and I mean, we wouldn't have an industry if we didn't have showing and performance.
Yes.
And so, I get it. We need to have all of that. But I think sometimes the area where horses get the least say in how they get to live is in those realms, because it becomes about the money,
Yeah.
and which can be tough.
Well, and the ironic part to me, I'm sure you see this too, is that it's hard to learn no matter how you slice it or dice it. Like I go to learn to ride really well or bring your horse up through the levels of performance. There's a huge amount of time investment in that as well as money. And to do it well, to me, doesn't take any more time than to do it badly. I go, to me, it's equal amount of time once you know what you're doing, but the information out there is sort of the band-aids and the shortcuts are actually sort of you're spending just as much time to sort of get the horse to perform, but now you're retiring your horse early, or your horse blows up and you lose all that investment, or your horse has a lameness issue and you lose the investment. And I go, for the same investment of time, I go, once the coordination is established as a habit in the nervous system, I go, you're done. And how fast that happens for
Right.
an individual horse is different. And it doesn't look as exciting because they're not breezing or jumping or doing their job yet. But I go,
Right.
that time investment gives you more permanent return on your investment than trying to get there faster with leverage and shortcuts and cheating.
Oh, absolutely. Well, okay, so here's an example. Within the last few months, we had a client who we were basically doing, therapy for an injury, but they weren't using us for any sort of functional medicine. We were just there to assist with the rehab, like laser and, those
Hmm.
sorts of therapies, veterinary therapies. And the horse was a young horse that had injured a proximal suspensory, which is pretty common in the jumping and eventing world, right?
Hmm.
But when you looked at the picture of the horse, there were all kinds of other things already at 5, that probably set that horse up to balance in a way that created the suspensory injury, right? So, the horse had never developed really well across the back, was kind of holding the back, hind end behind them, so not engaging through the pelvis and the sacrum. So when they look like that to me, I already know that if I can manipulate that, I can get the back working. But when they're stuck out behind them like that, they're not going to be able to build their back muscles,
Exactly.
right? Because they can't use them correctly. So lack of top line, the feet were maybe a little longer than they should be, right? So that's making it harder for that horse to actually stand and balance, right? So the horse is kind of leaning forward because of that. And then it had I think it had had a tooth removed or something. So it already had like a head issue on one side, right? So
Hmm.
that between the head issue creating a bend in the front end, right? So if you have, let's say you have a problem on the right skull, usually that ends up tilting the whole head to the right, and
Hmm.
that ends up pulling the whole right shoulder up, and then they put more weight on the left front. So just from knowing that something happened in the head, I know there's a problem in the front end and probably a rotation in the chest. And then from what I could see on the back end, I know the horse isn't engaging behind, so the back's gonna hurt, and then all of this. And so I wish there was a better way to get people to understand that if they really want this horse to succeed, if they did the work, the body work and the training to develop the body correctly, they wouldn't have the injury, in
Right.
the first place. It wouldn't happen again. But all they see is the spot that's, this big. That's the problem, right? They see that three
Right.
centimeter spot, and that's the area they're focused on, instead of looking at how much we can support that. Um,
Right.
and I think there's a lack of education
Yes.
that people just don't even understand how that's connected, I mean,
Right.
if you showed them a car and you were like, hey, you have a wheel that's like, got half as much air as the rest of them, they would know that over time you're going to end up with problems with the brakes and the axles and all this stuff on that side, right? They would get it. But for some reason, when you try to explain that to them with a biological being,
Yes.
they just don't get
No, and I
it.
often like I compare stuff a lot to auto mechanics because I go like so many horses have bad alignment. And I go,
Mhm.
and it's showing in the tires, the hooves, right? It's showing in the kind of
Right,
wear and tear on the car. And it's why the steering is not so good, or the brakes are not great, or the gas pedal doesn't seem to accelerate as well. And it's all because you have this, alignment issue that needs to be kind of repaired. And when we drive a car, I go, you can still drive a car that's alignment is off, but we really feel it. And that's what I tell the people. I go, your
right,
horse doesn't have a bad trot or a bad canter. I go, when they're in balance, all trots are easy to sit and they feel amazing and they have suspension. But if you have a bad trot or a big trot or a trot that's hard to sit, I go, that's telling you your car is out of whack. Like something you have missing air in the tire, or you have misalignment, or you have a bad brakes or sticky gas pedal. I go, it really is sort of a mechanical problem. It's not, I go, because even like some cars, driving a big truck versus a sports car does feel different. But I go, it's not that different. But if there's something wrong
Right.
with the truck or the sports car, that's a big deal no matter which car you're in. It's just not performing
Absolutely.
the way it should. But that mechanical
Yep.
comparison is like the only way I can seem to help people understand that it's not a bad trot because of the genetics or the conformation. It's a bad trot because he's out of balance.
Right. Yeah. Well, my husband and I had a discussion last night, and he loves to argue. So he likes to pick on my word usage and be like, "Did you really mean that word?" And we were talking about what I do, and I said, "I think it's truly like preventative medicine." And he was like, "Really? What are you preventing?" I'm like, "I'm preventing so much. If you can get that body so that it's mobile and balanced and talking, the the long-term effects of that, if you can maintain it, are, years of longevity, years of performance, years of health, so it really truly is preventative in that way, but he tends to use that very conventional mindset because we were talking about, even vaccines, and he's like, but you don't vaccinate as much as everyone else, so you're not preventing disease. I'm like, I'm making sure they're protected, and I'm not overdoing it, right? So, it's still the same question, but I mean, the key really is to try to catch things before they're an actual disease process, before they're an injury,
Exactly.
before they're something that you would need to use medications for, and try to just keep the body going as much as possible, for as long as
Absolutely.
possible.
Because you can give a vaccine and boost the immune system. Both things are true. I go,
Mhm.
it's not one or the other.
Right,
But the work you do,
right,
like what I've seen firsthand is when it comes to, say, lameness issues or the horse losing functionality, the most expensive part of all veterinary medicine is like lameness diagnostics. I go, or any kind
right,
of like, nuclear scintigraphy, MRIs, weeks in the
yes.
hospital, all these x-rays, ultrasounds. Like I go, we're just talking cha-ching, cha-ching, cha-ching. And now the veterinary rehab centers are getting really popular. And I go, they're wicked expensive compared to sort of like an
Yes.
osteopathic treatment or learn how to train your horse. Uh, and yet people will spend tens of thousands of like we're in the tens of thousands of dollars when we're talking,
Hmm.
those kind of diagnostics or surgeries. And I go,
Yes.
and you're saying you could prevent those massive vet bills by understanding a little bit how osteopathy works, how the body is connected, how you can kind of restore the body to its healthiest state. Yeah.
Well, and I think osteopathy works like two ways in those. I've seen it happen two different ways. So it's really great to use it as an adjunct, like with an injury, right?
Mm-hmm.
Because then you're helping to reset the body into balance so that the injury doesn't become repetitive and happen again. Then the other way it works sometimes is when you have that horse that's say 15 years old that we were talking about has the layers and layers and layers of issues. What sometimes happens is we get through all of the compensations that they've put on, where they started leaning this way because this hurt, and they started, restricting movement here because that hurt, and they started not bending this way because it was hard. And, you get through all of those things, and all of a sudden you'll find one lameness that comes out of it. So
Mm-hmm.
instead of them going to their veterinarian and the vet's like, I don't know, they're lame in like 3 out of 4 legs, and I don't know where it's coming from, and they're having a really hard time blocking it. What sometimes happens is we do the osteopathic work, and then all of a sudden it's apparent, like, oh, they have a problem in their left front fetlock, or oh, it's definitely a problem, in, whatever, the knee or the hock or the neck, because you get rid of all of the things that were there to help balance and protect that area. And so then it comes out. So I definitely see that happen as well. Like not only do we help the ones where they've found something to get better, but sometimes we end up finding that thing when we
Absolutely.
start
I
balancing the
I
body.
actually just had that conversation with a client because in rehab, once we get into the, say, unsafe behavioral issues or painful lameness issues, those horses always have multiple layers of compensation. And I always feel like I'm peeling back layers to get to sort of the original one, which is what the baby horse would have, that's just straightforward,
Mhm.
right? But it's like the longer it
Yeah.
goes on, and especially if there's a pain issue, like her horse had the same proximal suspensory strain on her right hind, but she couldn't figure out why she was
Okay.
overloading her right front. But we sort of went through it and go, that's her double compensation. That's a second compensation on top of most horses, if they're
Hmm.
restricted in the right hind, they overload the left front. And she goes, I can't figure out why she shifts her hindquarters this way and her neck that way and overloads her right front. And I said, that's called a second layer. Maybe there's a third one in there. And so, kind of peeling that back is absolutely normal. And I go, but if, like you said, if people understood that baby horses have to learn how to carry a rider, that is not just, it's more than just not falling over. There's a lot more to it, right?
Yeah.
And with a baby horse, you have all these little sort of personal ways of compensating and idiosyncrasies, but they're simple and they're close to ideal. You only have one layer to go through, or maybe two. But once they've become lame or behavioral issues, you could have my extra dressage horse that was given to me probably had about six different layers, and two of them were major. But underneath that, as we've peeled back, there's the baby layer. I go, there it is. There's like the original issue that
Right.
was never addressed.
Yeah, absolutely.
So,
Definitely find that.
yeah. And I'm sure you feel it in your hands when you're doing osteopathy work. It's like that you're feeling how those patterns, how that horse came up with that pattern in order to stabilize. And that's the part I find fascinating. It's so unpredictable.
Well, and you tend to find like there are typical patterns, and then there are what I usually call decompensation patterns. So there's the pattern that flows, like you're talking about, like, a diagonal pair, of weight bearing, right? And then there's the opposite. And I think what I find is the horses that actually end up with injuries are the ones that end up with a decompensation pattern on top of their natural compensation pattern. So they were doing great, and then all of a sudden the opposite leg got restricted, and now they had been, moving, bending right and not left, and that was fine. But now all of a sudden they can't bend right, and they're just done, and they're super frustrated, or that's when they start acting out, and it's that second or third layer that just really restricts the ones they've been able to function with, is when
Right.
you get the behavior problems. Yeah. And
I
that does make it hard, right? Because then there's so many layers, and it's not just one treatment, it's multiples to get through all those layers.
It takes longer to have to unwind that than it does to put the right stuff in the first place. I think that's what you were saying too. Yeah.
Right? Yeah, if we could get this, yeah. Well, I mean, and I guess, since we have a few more minutes, I'll get on my soapbox a little bit about that. I mean,
Okay.
I think that if we wanted to be really aware, we would realize that the last growth plates to fuse in the body are the vertebrae.
Thank you.
And if we think about it that way, then they're not ready to be ridden when the growth plates in their knees fuse. They're really not ready to be pushed until the growth plates in their vertebrae fuse.
Which is around 7 years old.
Yeah, like 7 or 8, right?
Hmm.
So I get really frustrated when we see these horses that are, usually it's the hypermobile dressage horses, right? They're so hypermobile and they're huge and they're still growing, and they're being put into these smaller frames that really collapse and crunch and close the space in that thoracic inlet, base of the cervicals, last couple cervicals for first thoracics. And I just wonder how much of those abnormalities that we see there are because of the forces being put on those vertebrae before they're completely formed, versus that it's all genetics. I think a big part of it, that the reason that they have problems there is because we're doing it while those are still flexible growth plates and things are moving around and able to change and dissolve, and be reabsorbed and modified.
Yeah.
And that we need to be really aware of what kind of stress and strain we're putting on their backs.
That's
So,
exactly it. Because I go, even like we think 7 years old, they should be in their first Grand Prix test. And it's like, no, they're still like that skeleton is still kind of solidifying,
right.
no matter the breed.
No
I,
matter the breed, it needs to not be compressed. It needs to
mhm,
be an expansion, so those vertebrae can have the ability to be the size they need to be and expand and not have pressures on them until those vertebrae are all done fusing,
right,
and the growth plates are gone. We really should not be doing any compression, on the
right.
vertebrae. Which, I mean, that's really hard for people that's a long time to wait, but if we change the way we thought about it and just said, okay, then they just need to be in a big, long, frame, and they
Well, and
need
I think Deb and
to
I did a podcast on that because even like I'm old enough, Deb's old enough that we remember when Hunter and Western Pleasure were long frames but balanced frames. I
right.
go, you can have a long balanced frame.
Yes.
You don't have to go to the highest level of balance to get performance. So I go for the first 7 years, if the lower levels of dressage were looking for long and level instead of all these other movements or even the
Right.
lateral
Yeah.
work. I go, the lateral work is pretty tricky. And when you're doing lateral work with a kind of unstable spine, you can really wreak havoc. And it's,
Mm-hmm.
the lateral bending done correctly for horses is, first of all, I think grossly misunderstood across the industry. And so most people aren't doing it in a safe way mechanically. And I
Mm-hmm.
go, then if you add growth plates haven't finished stabilizing the spine, I think that's why horses are breaking down by 10 or 12.
Yeah, exactly. Yeah. Yeah, I like the way that you describe that as long and level.
Hmm.
I think that's a much more accurate terminology, because as soon as they get too low, then they're behind the vertical again, right? These people that have them too low, they still have them, over bent when they get, so it's really long and level and stretch, that extension of this, or it's not really extension, the expansion of the spine, because they're kind of in flexion.
Yeah,
Because
and it was just an observational thing over the years, but I go, the neck muscles are usually reflecting how the back and hindquarter muscles are being used. And I
Mhm.
go, I don't care if it's a horse shortening the neck up or shortening the neck by over curling, or what I
Mhm.
see that's new in competition is horses shortening their neck like a turtle, like they're kind of pulling their neck in. I go, that's a little new and different.
Yeah.
Um, but any neck shortening is reflecting the concentric contraction of the back muscles that's always related to spinal extension.
Right, and
I
we
go,
don't
so
want
the length, it's not long and low that creates the stretch. I go, that lengthening of the muscle
that.
is
Mhm.
related to flexion. Even if it's not the highest degree of flexion or the highest degree of engagement, that eccentric contraction through the top line is always going to tell you that the back is lifting, even if you can't feel this upward force yet. And
Yeah,
I go, long and level is like just the safest basic trail riding posture, low level jumping, Western work. You can even work cows in that posture. I go, this
it's
is
where
not,
they want to be. It's where they're balanced.
yeah,
When you give them a choice, you'll find that the, top of the sacrum and the withers and the, TMJs will line up. If you give them
mhm,
a choice, that's where they want to be balanced. Yeah.
yeah. And
Mhm.
I go, they are horizontal axial skeletons. They're
Mhm.
not meant to be U-shaped over gravity, and they're not meant to be plowing into gravity. They just
Yeah.
kind of align with gravity,
Yeah.
nose to tail.
I'm glad we agree.
Yeah, yeah, and I just think that part is lost in our modern competitive world. It wasn't always lost. I go,
Right.
it used to be a very, that was the frame of all the thoroughbred hunters,
Hmm.
and even some of the jumpers. And it was like, or fox hunters, not jumpers, but it's like even pretty athletic work can be done in a long and level frame.
Yeah. Well, and it makes the body move more correctly, and you're gonna have less injuries, and you're gonna have a stronger horse, and there are all these reasons to do it that people have forgotten about.
Thank you for confirming that.
A good thing.
Yeah, it's nice to get on the same page.
Yeah.
So, anything you want to add before we wrap it up about, and your history of osteopathy was super helpful. Um, Ironically, the osteopath, Gavin Schofield, who I worked with, who is in England,
Hmm.
he was saying to get your DO as a human osteopath in Europe is the equivalent to a specialty, like your surgical specialty. So you get your MD and then you do your DO after that. And in the US, the MD and the DO are sort of the equivalent,
Hmm.
and which I found interesting,
Yeah.
especially if it
It's
kind of
very
came out of America. I was like, wow, really?
well, the reason that we have modern medicine the way we have it is that Johns Hopkins was used as a model for modern medicine. And I think what happened is that Congress wanted to pick a model. And so, okay, what's close to Washington, D.C.? Well, Johns Hopkins is right there. So that's where they went, and they saw how they were starting to teach medical students there. And so that's the group that was sort of put into political, coding and policy and government, support. And it was just that those were the hospitals that were allowed to, be more supported by our government, right? And how they were licensed and how they were allowed to foster and grow. Whereas a lot of osteopathic schools weren't allowed to, their graduates weren't allowed to practice in hospitals,
Mm,
because of the way that we were, just working as a government. And so I think that's sort of why it changed. And then when most of these DO schools that are being formed now are being formed at colleges that are just finding ways to make more money, right? So a
uh,
DO school is much easier to build and start than an MD school. So I think that's kind of what's happened is people are saying, oh, we want to add a medical school. We'll just get a DO, school started. It's easier, but they pretty much teach the exact same thing as the medical doctor schools, the MD schools in the US. So they get very little of the manipulation, and
the
that's why,
actual osteopathy.
yeah, it's just
Yeah,
not really a part of what they're taught anymore. And then when they finish their DO, they go and do a fellowship or residency or internship in traditional medicine, right?
right.
So most of them don't then leave their DO school and join like a naturopathic, practice.
Hmm.
Most of them then join a conventional medicine practice, and so
Right.
they sort of lose that.
And it just gets put to the wayside, all of the DO stuff.
Yeah, I mean, and in veterinary school, they don't teach it at all. So, I mean, if you're interested in osteopathy, you're gonna have to get it after veterinary school. You're gonna have to find someone who does it and be interested in it. There's a couple organizations that are teaching it, but they're not in the veterinary schools teaching it. So you really have to look for it if you're interested in it. It's just not something that's mainstream.
Right. Right.
Mhm.
All right, I better wrap it up. I think we've been yapping for an hour.
Sounds great.
So thank you so much for joining me. You're always this wealth of information. Like I just
Thanks.
open your mouth and I just learn and learn and learn every time we meet. So thank you.
Mhm.
And thanks everybody for joining us for another episode with Dr. Anne-Marie Hancock. I love these interviews and we look forward to seeing you again in the future.
Yep, we'll have to come up with another topic.
That's right. Oh, and anybody out there, thanks for sharing, liking, subscribing. And if you have questions, put them in the comments. And that is a good way to come up with topics for the podcast. Absolutely.
Absolutely. Yeah.
Yeah. So thanks, everybody. And we will see you on the next episode.